Are there devices, I hear a word c-pap, are there dental devices, are there c-pap machines, are there things that stimulate the tongue, are there things that we can do to open up that airway where we don't have sleep apnea with snoring?
Yeah, there are many options now, more than there ever used to be. And again, if this is the problem where that tongue rests against the back of the throat, the name of the game for treatment is to get that tongue off of there. So those c-pap machines, little breathing machines for sleep, use air pressure to do that. Just blow the tongue forward. It's like the air compressor at the gas station. You just put air in your car tires, but nicer looking and smaller and quieter. But you don't necessarily have to use that. You can mechanically pull the tongue away, and those the dentist gets into the picture here by making a little mouth guard. These have been around for a long time, but the biggest hurdle for them was always a cost issue. Medical insurance didn't cover them until about 5 or so years. And now that medical insurance has covered them, you hear a lot of advertising about mouthpieces for snoring and apnea. But the process is the same. Move the tongue forward, in that case by moving the entire jaw out, because your tongue attaches to your chin. So as your chin goes out, your tongue gets pulled away from the back of the throat. And there are some more either invasive or high-tech kind of approaches that aren't for everyone. And these are neurostimulators that try to get that tongue muscle activated while you're asleep to move the tongue out of the way.
As I'm listening to those answers of opening up the airway, it seemed like somebody who is a specialist would be able to guide which seems to be best for that person. So is it a good thing for people to have a sleep study?
I think so, because you've got to figure out where you stand on that spectrum. You don't necessarily want to get some invasive surgery for a very mild case that can be cured by a little bit of weight loss, per se. If you're on the other end of that spectrum, very severe, which carries with it a lot of risk to your heart, to your brain, everything else, it's a different ball game. You're looking at different treatment options there. So that's what I do on a daily basis when I review people's study results. I'm trying to figure out a game plan.